Hi, Dr. Brian Kaufman, a retired family doctor, CLL patient myself, co-founder, Executive Vice President, Chief Medical Officer at the CLL Society at ASH 2024.
I am Dr. Christopher Pleyer. I am an Associate Research Clinician at the National Institutes of Health in Bethesda, Maryland.
One of the long-standing programs the NIH has had is a very interesting trial, and it's not to treat CLL, but to watch CLL. It's called the Natural History Trial. So tell us a little about that trial, why a patient might be interested in it, and what kind of patients you're looking for.
Absolutely. We've really been very fortunate to be able to see many patients along the variety of their journeys that they've had over the course of the disease. This is a trial where we are seeing patients that are both treatment naive, so have never had any treatment, that are on active surveillance, or are already getting treatment. And we are interested in collaborating with them, following them, and learning from their CLL. We know that CLL is still a very heterogeneous disease, and this study has really helped us understand CLL better. One thing that we've been looking at recently is looking at the impact of nutritional supplements. We are hearing from some patients that nutritional supplements may have had some beneficial effects for their CLL, and we're actually interested in understanding that a little bit more and seeing what are the underlying mechanisms of how these supplements affect their CLL, and can they in fact improve the symptoms or even the CLL itself.
I got to give you a chance to give a little bit of a sales pitch. The NIH, being a government institution, you cover much of the cost for patients for this, right? Explain that so patients can know, because you have to get to Bethesda, so which isn't, if you live nearby, great, but most people don't. So tell us a little bit about what the patient can expect out of pocket to do this.
Well, we ask a lot from patients to travel to us and spend time with us, talking with us in clinic, donating blood as well. But we don't want this to be a financial burden for them. So the NIH does cover travel expenses, meaning the travel to and from the NIH, and also gives lodging reimbursements as well for hotels or Airbnbs.
And all the medical care is free?
Absolutely, yes. All the medical care, second opinion is free at the NIH.
I think it's a fabulous program, and I highly recommend it. And I would highly recommend to patients to do it not just when you're in a crisis in CLL. Probably that's not the best time to do it. The best time to do it is when you're in active surveillance or watch and wait. If you're considering to do something to see if it affects your CLL, why not get the benefit of the NIH to say, hey, if I begin this exercise program, if I take this supplement, is it making a difference? Because you guys can monitor that, are very sophisticated at looking at how that affects the CLL cells, but also how it affects the other cells in the body. So very important, very exciting, and I think it's an opportunity that more patients should avail themselves of. Thanks so much.
Thank you very much.